presentation is on bone cancer. Us three decided to do this, just kind of picked it out. Thought it was interesting, and a couple different things that I learned a lot about on these next couple slides. So the first thing that we talk about when we talk about bone cancer is we want to look at the symptoms that it provides. It's a lot of different things. There's a lot of inflammation when it goes into it with bone cancer and every type of cancer. But specifically looking at this, you're going to see a lot of pain with activity, swelling in the joints, and it's going to be a lot worse at night. You're going to experience significant weight loss, and you're going to have lots of fatigue when you do things. You're also going to be walking with a limp, or you're going to have weakness in your limbs that are affected. So, and it's most common is just kind of having pain all around. You're going to see that through your everyday activities. So there's two ways to assess this. There's physically and there's historically, but let's talk about physically first. The physical examination when you see someone with bone cancer is when they come in for a checkup. You may see them, they have maybe big swelling points on their legs and arms and or places where it is actually present. You may see the blood is very, very thick around the area due to inflammation. And when you do these physical exercises, you'll see different types of motions that they have. Walking around can be painful, swinging their arms, different range of motions, exercises that you'll have them do. You'll see how they work. There's tender spots and weakness in appendages. Again, do they limp? What are they doing when they go around? Are they showing pain? Are they wincing and all that stuff to show how hurt they are? Just simply observe it with your eyes. Be able to physically assess them. It's one of the things us as nurses do, and this is what we must do in the future. Testing can also contribute to figuring it out. Range of motion exercises is a great way to do that. You can physically assess them in a lot of different ways. Historically, when they come in, we're going to ask them a lot of questions. First question I would probably ask is, when did this start and what are you experiencing when you have pain? The buildup of pain, and it starts problems, all sorts of problems. So if you're talking about walking, you're going to see it in your knees and your ankles and all that stuff. You also want to talk about the family history. Let's see here. There is two things that really attribute to the history of your heredity. So you have your retinoblastoma, your eye cancer, and then your multiple heredity exotosis, which is your abnormal bone growth. You also want to ask about their recent weight loss or what they've been feeling. Are they sick? What's going on with them? All those different types of questions will help you get to the bottom of what's going on with them. So we have a couple causes here. The first one being exposure to therapeutic radiation. So different types of things that will expose you to that chemical or radiation will damage that. The genetic influence is a possibility, like we talked about, the retinoblastoma. And then hormonal functions, what's going on in the body and how are they processing and how are they doing different things and are they working properly is one of the things that you'll have to find out. It's most common in adults, and they're already affected by the disease anyway because of how old they're getting, and different things such as age will attribute to that as well. The trauma that they've been through, what did they do in their past, what is attributed to what is going on, and then bone tissue abnormalities, which is how is the bone grown after different things. So, let's see. Yeah. Reports with siblings with bone cancer too, figure out what their family is like, different people, and how did they get affected, or what have they been sick, or different types of things like that. Bone cancers tend to be more common in adults, and then males as well, 18, and then over 60. So when you're diagnosing it, you want to look for sarcomas, which is basically the inflammation of the bone, and in different areas where bone growth is abnormal. So there's three types. There's the osseous, so it's growing in the actual bone and that tissue. You have the cartilage, so in between the knee or in between the elbow and different areas where it protects it, you can see a lot of inflammation there. Or you have it in the membrane tissue, which is just basically all around, kind of what you can see here. So in general, bone cancers are sarcomas, which are cancers of the connective tissue, like those three listed there. And then cancers are originated from those three areas. And as you can see, there's a picture of mass unusual cell growth in the bones, and this is an example of osteosarcoma, which is the most common type of primary bone cancer. And it's diagnosed into three different categories. In this picture, you can see it's more localized in one specific area, but according to SEER, which is surveillance, epidemiology, and end results, they talk about 3 different areas: localized, regional, which is more of like the entire leg, and then distant, which is the entire body. So there's a couple risk factors that play into this, more historical than physical, but the retinoblastomia, or blastoma, like we talked about earlier, is affecting all the tissues around, not only the eye, but the history of that will also contribute to the cancer. You can see there a couple other things that attribute to cancer and the problematic stance that it has, just all this type of stuff right here. Yeah, so it's pretty cool. A couple treatment ways that you got extensive surgical reconstruction. So basically it's like taking that lump or that infected area and taking it out. Because it is a sarcoma, you can actually physically remove it instead of having chemotherapy or radiation to the area. You can also amputate the limbs. This isn't very common anymore, but you can definitely still see it in some cases where it's really, really bad. Radiation also, if you really decide to go down that route, there is an option for radiation, and then chemotherapy and bone health medications. So just basically reducing the swelling in certain areas and providing different ways to help. So then the prognosis and the follow-up, the 5-year survival rates for adults and children is about 70%. So in about 70% of cases, you're going to see that when you get treated, those patients are going to live for 5 years or longer. Just like someone that doesn't have anything wrong with them, their probability of living past that is 70%. After getting treatment, get checked regularly for 5 years. I believe 3 to 6 months for the first 3 years is what you need to be checked in for. And then after that, you can do it once every 6 to 12. And then tell your provider if you obtain any weird lumps or abnormal swellings after the surgery, because this could lead to a remission of the cancer. So this here, like we talked about earlier, explains the 5-year survival rates for the 3 different locational diagnoses. So we talked about the localization, which you saw in the picture before, is 91%. So if you catch it early, you're able to have a much better chance of living 5 years after the surgery compared to if you were regional or distant. And distant, obviously, one in 3 people live after they have the cancer removed. So there's 2 types of ways to get the bone cancer, is the osteosarcomas and the chondrosarcomas. So in 70% of cases, you're going to see it inside the osteoblast and osteoclasts, where the cancer actually originates from. And then the Ewing sarcoma, the chondromas, and the fibrosarcomas are 30%, which makes up of the muscle and more of the soft tissue that lays around. More prominent in males, especially people that are teenagers and people that are 60 plus. So you're going to experience a lot more of that because of the wear and tear that is produced on the body. And then other symptoms include remission, or other symptoms of remission include coughing that doesn't stop. So if you continue to cough and you don't feel better, go in and check with your provider and see what goes on. So that's it.